on 760 WJR.
A pretty scathing response, not just to the undercounting of nursing home deaths in Michigan, but to the health department's attempt to skew the perception of an independent investigation. Now, we have mentioned the Michigan Auditor General's finding that the Whitmer administration undercounted COVID deaths in nursing homes by about 30%. Well, now 3 senators, Ed McBroom, Lana Theis, and Doug Wozniak, have responded, Kevin, to what they say is a gross mischaracterization of the Auditor General's report.
Look, this is a really, really important issue. It's not something where we should be playing games with the numbers. We should not be arguing over what is a nursing home and what is a long-term care facility. The goal here should be to never let this happen again. And to do that, we need to be honest about what happened. If we underreported long-term care facility residents who died from COVID, we need to admit it and learn from it. I don't know if we're going to do that if we're fighting over how the Auditor General did the report. But to your point, let's get Lana Theis on, state senator from Brighton, who is part of this trio who's come out to talk about this. Good morning. How are you?
I am well, and thank you very much for the opportunity to speak about this. I can't even begin to express how important this issue is.
Yeah, it truly is. So tell us a little bit about the findings and then the response to the findings by the administration.
So the Auditor General is known for being a nonpartisan organization. They came after the Republicans when the Republicans in power. They're coming after the Democrats when the Democrats are in power. They're doing a thorough review for the things that they are asked to do. And so from my perspective, the primary thing we need to know about this policy is for all of the facilities that were affected by the policy where COVID-positive patients were being put back into them, what was the death rate? How many people died in those facilities from COVID or because of being in those facilities from COVID? And so this Auditor General was tasked with doing a much more deep dive into the actual numbers. And even so, even with the numbers that were reported, by the way, all of the assisted living facilities which were actually required to participate in this policy were not required to report after October of 2020. So we don't, and so those numbers were completely removed. The numbers that are high should still be higher, in my opinion, based on the fact that all of these assisted living facilities, their numbers were not included. They can't be known, frankly. They're not licensed. We don't know where they're at. And so those numbers are very difficult to get. But they were, in fact, affected by this policy. They were required to comply with this policy, required to accept COVID-positive patients back into their facilities. And people died as a result. We saw it in New York. We want actual numbers here, and we've got a much closer reckoning, though I think still low, and I think low by their own assessment when you look at the previous oversight hearings that have approached the subject.
The current administration says we can't really trust the Auditor General's numbers because they say the Auditor General is being political. Can we trust this report that has come out?
They weren't saying that the Auditor General was being political when they were going after the Snyder administration for things. They weren't saying the Auditor General was being political when things happened negatively with Republicans in power. It's just a very politically convenient position to stand on. And what they're mad about is that the Auditor General didn't just review their own numbers that they had to make sure that they'd added and subtracted according to what their numbers said. The Auditor General did a much deeper dive. They took a close look at the folks who were associated with the nursing homes, with the long-term care facilities, and then ended up dying of COVID shortly thereafter. So these numbers are definitively more accurate. The political pushback from the administration is unconscionable. What we need to be looking at is this policy harmed our most vulnerable. We can't ever do that again. And not only did we kind of double down on it, I put out a letter in mid-April of 2020 saying that this policy was bad. HCAM came out with a letter that said that this policy was bad and was likely going to result in people dying and was utterly unworkable. And she stayed with that policy. That letter, by the way, also says that if she had spoken with professionals, and she might have had much better informed policy. But if she had let go of that policy and moved to a policy where we protected our most vulnerable, I think many, many lives would have been saved. And I think that's obvious from this report.
Yeah, Senator, the governor flat out denied that this policy existed, at least to us. back in 2020. And you highlight this policy that have led to more deaths. And the letters that you state this in the letters that you have written out. You cite Executive Order 2020-50, which you say this, quote, the order forced facilities to take in infected persons even if it meant housing them with healthy residents. At the time, the administration chose to decline offers to reopen closed facilities as quarantine facilities or utilize special sites it had prepared. You're saying the Whitmer administration's approach to treating elderly COVID patients in nursing homes where there were also healthy residents did in fact occur. And that was a policy because we were told otherwise.
It's written right in 2020-50. It is absolutely there. There's no doubt that happened. There's no doubt that they felt like they had to. And for them to deny their own executive order is astounding to me.
Elizabeth Hertel, her claim was essentially that the Auditor General somehow wrongly chose to include the deaths from elderly COVID patients who were in these long-term care facilities that were not required to report those deaths, but they were still elderly COVID patients who died in those long-term care facilities, right? So why did the health department refuse to include those deaths, do you think?
They're trying to play with technicalities. They're trying to follow different rules at different times as a convenient point for them. But there's no doubt, like the question is, who did your policy apply to and what deaths happened in those facilities? It's a very simple question. But up until now, we didn't even have the beginning of a true answer. And admittedly, by the health department's own admission through our committees, they had an inaccurate number. They admitted that it was undercounted. And now when they have a more accurate number, their response is purely political instead of trying to make sure that this never happens again.
State auditors concluded that the administration bureaucrats either miscalculated or misreported, possibly misled the public about the number of COVID-19 deaths. If true, what should be done about that and what can be done about that?
Well, I think this is something that our our Attorney General most certainly ought to be looking into, though I believe she's already said that she won't. But perhaps with this new information, she can. There is no doubt that there's culpability here. With as transmissible as COVID-19 was, to put COVID-positive patients in with our most vulnerable population, the folks who are most likely to get it and die, it doesn't take even a medical doctor to realize that's a really bad idea.
And real quickly, for clarification, you say in your letter that the director at the time, back in 2020, told the committee many times that they knew the count was wrong, especially early on in the pandemic. That was Robert Gordon at the time, is that correct?
I believe so, yes.
Okay, and why were they hiding this, do you think, that early on in the pandemic?
At that time, they didn't profess to be hiding it. What they said they just didn't have access to accurate counts. So people who were mandated reporters were not reporting, and they just didn't have the databases in place in order to track it per them. I'm not defending them, but that's what they said. Okay. So ostensibly what they should have done then is gone back and tracked it when that opportunity was available to them, and it doesn't appear that they did so. And even having worked in that space, they're saying that those numbers aren't real. My question is, how many people died as a result of the policies in the facilities that were affected by the executive order? And the executive order is quite clear about the facilities that are affected.
It will be interesting if Dana Nessel decides to look into this. We'll see if she does or not. But Senator Lana Theis, we do thank you for your perspective and sharing what you and why you wrote this very strongly worded letter regarding this issue. Thank you so much.
Thank you.